Although most stroke victims are elderly people, anyone can suffer a stroke. Typical symptoms are weakness and numb sensation on one side of the body, speech problems, problems with eyesight and coordination, as well as headaches. When a stroke occurs, time is a real issue, because every minute wasted results in the loss of brain cells. But what does actually happen when a stroke occurs? Basically, there are two kinds of strokes. Hemorrhagic strokes, or strokes where a blood vessel drains blood into the adjoining tissue. Strokes are called ischemic when brain arteries are clogged, preventing continued flow of blood. Blood clots and deposits of cholesterol can cause an occlusion of the vessel. The lack of oxygen induces both types of cell death, so-called necrosis and apoptosis, in the cells of the brain. Both are ongoing for as long as the oxygen supply is halted. At first, the patient has to be moved to hospital as quickly as possible. The physicians have to determine which form of stroke the patient suffered and which treatment applies. Special stroke units in major hospitals are specialized in the treatment of strokes. Now, either the clot is dissolved or the bleeding is stopped and the blood is drained from the tissue. Both treatment methods have to be applied minutes or few hours after the emergence of the first symptom. Though conventional therapy combats the cause of cell death and enables the blood flow again, the damage to the tissue is irreversible. The brain is not able to reorganize itself in a manner necessary to replace the lost capacity. So 2/3 of the patients who survive a stroke will still suffer from severe disabilities for the rest of their lives. However, new research in the field of stem cell medicine creates the hope of being able to treat strokes in a more efficient way in the future. Scientists of the Fraunhofer Institute for Cell Therapy and Immunology investigated the effect of stem cell treatment of an artificial stroke in rats. Following conventional therapy, the patient is treated with stem cells. Those accumulate in the defected area in order to assume the tasks of the destroyed tissue. Differentiated stem cells could take the place of destroyed nerve and glial cells and form new synapses between the nerves. Just like in conventional therapy, stem cell treatment also requires a long process of rehabilitation. During rehab, the patient has to relearn familiar actions like walking, speaking, and coordinating body movements. Animal experiments with rats and sheep showed very clearly that animals treated with stem cells recovered much better and regained more of their skills than untreated rats. The treatment can even be applied up to 3 days after the stroke has occurred. Although it is still far away from clinical use, this new technology could one day help save the lives and health of thousands of people and allow stroke victims to live a normal and happy life.